begin by giving you briefing as to the situation in our region. As of today, 6th of March, there are 189 confirmed cases in the region as of 10 a.m. today. Over the past 10 days, we have had 11 countries and territories, as well as the US and Canada, who have reported cases. These 11 countries are Brazil, Mexico, Ecuador, Dominican Republic, Saint Martin, Saint Bartholomew, Argentina, Chile, French Guiana, Peru, and Martinique. These countries are already in the response phase to cases and clusters of COVID-19. The countries of Latin America and the Caribbean are better prepared than 10 years ago, as they have learned valuable lessons from the pandemic influenza H1N1 and Zika epidemic. But what is required now is that countries are ready to respond today, and ready to respond with the tools that they already have at their disposal now.
We must be on high alert. WHO has raised the risk level to very high for all regions of the world. PAHO, the technical agency of the Americas, is working for some 118 years alongside countries for responding to disease outbreaks like yellow fever, cholera, dengue, measles, influenza, chikungunya, Zika, and now the novel coronavirus. We are working alongside member states to strengthen surveillance activities for the early detection of potential imported cases of COVID-19 and in ensuring preparedness. Since January, PAHO has trained and equipped 29 laboratories throughout this region to be able to carry out testing and diagnosis of COVID-19. There are actually 32 countries in the region with this capacity, with the CDC in Atlanta serving as the regional reference laboratory. PAHO has adopted its regional flu surveillance platform that now includes COVID-19. We have developed a hospital readiness tool which enables hospitals to assess and evaluate their preparedness for a potential imported case, and all member states have been using these tools. PAHO has provided training and risk communication for ministries of health to ensure that they are prepared to diffuse real-time, life-saving information on COVID-19 to populations to enable people at risk to take informed decisions to protect themselves and their families. PAHO is working intensely with the countries, all of the countries in our region, with particular emphasis on those with the weakest health systems. What must we do to be ready for COVID-19? The likelihood is that we will have a mosaic of COVID-19 situations occurring throughout the region at any one time. These will include 3 possible scenarios. 1, where there is no transmission, even when surveillance is adequate. 2, that there are outbreaks in closed environments such as nursing home, prisons, boarding schools, cruise ships, etc. And 3, there is widespread community transmission. We may see widespread transmission in the community, particularly with the usual seasonal occurrence of other respiratory diseases. A strong emphasis on stopping transmission continues to be an important objective, while recognizing that the situation may vary from country to country and will require tailored responses. So what can we do? There are three kinds of actions that we must take. We must contain the virus following its introduction through detection and isolation of cases and contact tracing. It is important to avoid overreacting to importations and identified outbreaks. We must put these events in a long-term perspective. We must be prepared to save lives. Working with the health sector, including protecting healthcare workers, ensuring that the health sector is ready to make the necessary arrangements in the health services to respond to possible situations as increased influx of critical patients. And we must be prepared to slow transmission. For this, we need a multi-sectoral approach, and these discussions must start now. This will include, for instance, education, transport, civil society, among others. We must be able to determine the public measures that will be activated, including school closures, cancellation of mass gathering, teleworking, and others. I must report that in the region, we are seeing strong political commitment, many countries at the very highest levels of government. This commitment is ready and has begun to lead the multi-sectoral response to protect citizens and to invest in the response. What can individuals do? There are simple precautions that everyone can take to prevent respiratory illness, including COVID-19. You've heard them very often. Wash your hands frequently with soap and water, or use an alcohol-based sanitizing gel. When coughing or sneezing, cover your mouth and nose with your flexed elbow or with a tissue. Dispose of the tissue immediately and wash your hands. Avoid close contact with anyone who has coughing and fever, and avoid frequent touching of your face, your nose, your eyes. These are some of the measures that PAHO is undertaking with our member states. We are available now for any questions that you may have. Thank you.
Thank you, Dr. Dieng. We're going to take questions from the floor first. Please identify yourself, and then we're going to take questions from the floor. So I think we're going to start first. Yeah?
Thank you for the opportunity. Voy a preguntar primero en español y luego en inglés.
I will ask the question in Spanish and then in English. I'd like to hear your views on whether we are over-exaggerating and generating hysteria with the coronavirus that, when compared to others, seems that it doesn't have the level of fatality or the level of cases such as one of a normal flu, a normal cold. And if all these measures that are being taken because of coronavirus are justified when we have other cases such as Ebola or Zika or malaria, which might lead to measures of the same type or of the same level, and we don't see these.
Opinion regarding to the general hysteria that is created by public officials and health officials regarding to the COVID-19, and if it's all these measures are justified, especially when we compare the COVID with other virus like the general influenza, Ebola, or others in the region. We have not seen the same type of measures, public measures, in the public arena. Thank you very much.
Thank you. Dr. Barbosa is going to take the question.
Okay, no, thank you for your question. I think that it's very important to have a proper and balanced response. But let's remember that we are facing a new virus that for the first time was found out in China in the last day of 2019. So this is a new virus. Nobody has any kind of immunity for this virus because this is a new one. So every measure that is adopted to protect the persons, to highlight the attention that the health service need to be prepared They need to strengthen the surveillance system. They need to strengthen the hospitals, the clinics. I think that they are totally justified. Of course, that any overreaction, and our director highlighted that we cannot overreact. We know many measures that have been adopted in countries that are aligned with the recommendations and technical guidance. We believe that they are properly adopted, but we do not recommend any kind of measure or any kind of action that can lead to prejudice or xenophobia or stigma against any country or population. So I think that is important to monitor the disease. Every day we know a little bit more about the disease. The disease, the virus has the capacity to spread very fastly, and now we have many countries facing the outbreaks. The disease, the COVID-19, has the ability to produce more cases that will overwhelm the hospitals and intensive care units. So I think that the health system needs to be alert, needs to put in place all the preparation plans that they have developed in the recent years and to be ready to respond properly and to reduce the risk and to save lives of the population.
Thank you, Dr. Barbosa. We have a question here. Please identify yourself and use the microphone. Thank you.
Hello, my name is Alina Dieste. I'm a journalist from AFP. I'd like to know, you're saying that you're expecting an increase of cases in the winter season. What's going to happen, for example, in countries that are warmer than the countries in South America? Are they to expect an increase of cases too? And if you think that's going to be a problem in countries like that do not have the infrastructure, maybe that more developed countries to face this?
Dr. Ciro Ugarte, Director of Emergencies.
Thank you. Of course, there are several countries that will face the seasonal influenza period, and those countries will face both coronavirus and influenza. And of course, there are also other places where this virus will appear, not necessarily related with the warm or cold seasons. And that is very important to identify that the preparation and the readiness of the health services is now for both coronavirus and the seasonal influenza and other diseases that are affecting the countries. And by the way, there are many countries that are now facing dengue epidemic, and this is that is also happening in many countries. So we have to, as Dr. Jarvas mentioned, we have to put in a balance between what is happening with the emergencies that they are facing, the countries are facing, and then the seasonal influenza and other diseases in the perspective.
Sorry, do you think they have the resources to face this? I'm thinking about poorer countries than the countries that we have in the North Hemisphere.
As the director mentioned, the chief of states are taking this very seriously, and on top of that also PAHO has been providing technical cooperation and also essential support so the countries may face the initial cases. But we cannot transform the reality in just a few weeks. We know that there will be a situation where the countries will face, and of course also the international and the solidarity in the Americas will be needed to support other countries, as it happened in the past.
Thank you, Dr. Ugarte.
I'm Jason Beaubien with National Public Radio. Brazil at the moment is testing hundreds of suspected cases. I'm wondering if you could give us a sense of where you think this outbreak is in the Americas at the moment. Is there the potential that you have undetected cases similar to Iran that didn't get detected, or do you think at the moment that the confirmed cases that you're seeing are that you have managed to identify them, or is there the potential out there that there's some widespread cases occurring in places that are not being detected right now in the PAHO region?
Dr. Ugarte.
I can begin responding to that question, and then I will ask Dr. Silvan Aldigeri, incident manager for this event, to also give some additional information. We have been working with the countries strengthening their surveillance. Actually, the Americas has one of the strongest surveillance system for acute respiratory illnesses in the world. And also, in the Americas, we have the highest coverage of seasonal influenza. So we have information regarding what's happening. And in addition, vaccines for seasonal influenza. But in addition, we've been working with all the countries and strengthening their laboratory capacities and their surveillance capacity. So we are seeing that the countries now are able to take the samples and confirm the cases very quickly. Still, we understand, we know that there may be cases over there, and the challenge is to find them as soon as possible. Dr. Aldilleri?
Dr. Silvan Aldilleri, sorry.
Yes, good afternoon to everyone. We are not looking only for cases in travelers. This is a scenario we are working on for 2 months now. We are also looking for cases that can emerge from the community. And the best way to do it in this region is to use the flu surveillance system to which we have added COVID-19 with a wide range of laboratory facilities in this continent linked to the established existing flu surveillance system. So this would allow us to detect these cases not related directly to importation, the first chain or the second chain of transmission.
Thank you. Is there another question? Guillermo? Sorry. Oh.
Guillermo Garcia from FN News. I would like to ask if there's any countries that are in more risk of getting the epidemic, not the epidemic, but the coronavirus more spread.
No sé si se pudiera clasificar como
cases. I think what is very important is that we recognize that the countries with weaker health systems carry a higher risk not just for importation, but for their ability to ensure strong surveillance, with the ability to be able to detect cases early, and very importantly, with the ability to be able to manage cases to save lives and to ensure infection prevention and control. And that is why we have strongly targeted these countries for intense support from PAHO. And starting next week, we will have a team going to particularly our key countries, but those with weaker health systems, and beyond that to all of our countries, to be present in country, to review what they have done, review their national plans, how they've implemented those, review their surveillance systems to ensure that infection prevention and control preparedness is there, to ensure they've identified where they are going to isolate cases, where they are going to quarantine, where they are going to manage. So we will be on the ground to assess and to help them address some of the very real issues that will be important if we are to be able to respond positively and adequately to COVID-19.
Thank you, Dr. Etienne. I think we have someone there, and then we go to Usman. Yeah.
Hi, Teresa Welsh with DevEx. I'm wondering if there's anything in particular you're doing looking at migrant populations. Obviously, heavy movement, Venezuelans throughout the region into Colombia and Brazil specifically, but really all over South America, as well as folks coming from Northern Triangle that are moving throughout Central America, and how you perhaps are working with organizations to ensure that these populations in movement are not going to be spreading the virus. Thank you.
Dr. Ugarte?
Thank you. Yes, we are in close contact with IOM, International Organization of Migration, and also UNHCR, but most importantly with the member states, to address the migrant population as one of the populations to follow in this. You may know that the migrants may not have access to healthcare, that easy access, and that not having that access to the healthcare also prevents them from being early detected and treated. So those are the challenges that in the countries that have more migrant population face. No? Thank you.
And maybe I should add that by next week, WHO should have completed guidelines for the working with and managing migrants and internally displaced populations. So these are guidelines that should be on the WHO website soon, and WHO is working with the other related agencies to develop those guidelines.
Sorry, is there any other question? AFP, yeah?
Yes. Oh, I'd like to know which countries you're going to go first. You said that there were some countries that were weaker than the others in this preparation. Can you tell us what countries are?
But let me first say, we didn't say weaker countries. Countries with weaker health systems. I think that's an important distinction.
Thank you, Silvana Dier.
PAHO has in peacetime also a set of priority countries. We call them key countries because these are countries with more challenges in terms of health systems. But definitely we are starting with Haiti, Venezuela, countries of the Guyanese Shield, also Caribbean island states. It's a very particular settings, and countries in Central America and South America as Nicaragua, Honduras, Guatemala, Bolivia, Paraguay. But saying this, we have already countries that have cases and clusters of cases, local transmission. So at the same time that we are helping in the readiness of the countries not reporting cases, we are already assisting countries in responding to their local situations.
Thank you, please.
Can I add something? I think it is important to note that PAHO has very strong country offices in every one of our countries, except for the small island development states. When we say we have strong countries, we do have expertise in disaster management and outbreak management, expertise in health systems, and our country representatives, or PWRs, are working with member states. And so it's not that this team is going de novo, that this has happened and is ongoing. This is just a verification team that will make those visits. I think it's important to note, too, that this, for COVID-19, this is not really the first time that we are assessing what are the health systems capacities of our member states. In fact, our member states report every year, and it's a self-assessment on international health regulations and their core capacities, which includes their health situation. In 2016 or so, we actually conducted in-depth reviews of every country's, 26 countries' health systems, to ensure that those health systems were up to date, and that was the time of Ebola, I think. But also we identified what were those gaps and made recommendations for addressing those gaps. Many of those recommendations are true for today as well. And so our member states have all of these things, and as I say, our country offices are working assiduously with our governments, with ministers of health, but very often are called in to the President's and Prime Minister's office to assist and to work with them to ensure that they too can have the well-informed response in their particular countries.
Okay, Dr. Etienne.
Yeah, this is Jason Beaubien with National Public Radio again. Just specifically on that, do all of the member states have the ability to test for this virus? And if not, how long potentially might it take for some samples to get get tested if those countries don't?
Dr. Aldigueri?
It's an excellent question. At the moment, we have 32 countries and territories in this region with COVID-19 testing capacity. PAHO has supported directly 29 of these countries, and we have trained and equipped these countries for at least testing at the national reference level. Some countries of the Caribbean did not have the flu surveillance capacity, including the labs, and they rely on the Caribbean Public Health Agency, which is based in Trinidad and Tobago, for testing. But this was a decision made by PAHO very early on during the outbreak to ensure laboratory capacity in all countries with existing flu surveillance laboratories.
Dr. Espinal?
Thank you. I just want to add, building on what the directors and Dr. Aldigueri said, let us remember not only the IHR, but this region has a strong experience dealing with massive outbreaks, H1N1 in 2009, and after that Zika. So the region is better prepared than at that time, and the lessons learned are taken very well by the countries. As when we talk, in fact, on Monday, the director held a conference call with all the ministers and vice ministers of health of the region, and the commitment it's outpouring. So I think it's important that to acknowledge that the countries are not starting from scratch in this case. Thank you.
Thank you. I think we have time for one more question. Or if there are no more questions, we would like to thank you very much for being here with us today. And thank you again, everybody, and we'll see you next time. Anything else?
So, let me thank you for this opportunity to speak directly to the peoples of the Americas. And let me commend you for the work that you, as media, that you are doing to bring this information to our peoples. And finally, to say that we must connect with our peoples and to help them to allay anxiety and to allay fear, but also to empower them to better prepare themselves for prevention, and if they do, God forbid, get infected, that they know exactly what to do. So thank you again.